Hello. Okay. So I know it is Kansas City Parade Day, and I was actually there, and everybody knows that I am a huge Kansas City fan. So this is the first time I am going to broadcast a webinar or any recording from my basement because my basement is all Kansas City. Yes. Lots of Kansas City. I'm very proud Kansas City girl. We have lots of KC. You can't see it, but there's like Chiefs and Royals everywhere down here. So, and this is a vintage 80s jacket from my mother-in-law. I know that's not what you joined for today, but that's what we're going to start talking about is what you joined for. So, tonight. And I did think about moving this to another night, but my schedule is insane. So I want to do this tonight. And there's another part of this, which is all about things about pain and inflammation, etc. But tonight, what I really want to focus on, because when I really started to do the PowerPoint, is that there are so many things that we do in regenerative medicine and PRP and all these amazing things. That I wanted to really focus on what we do as a practice and as a company and as a physician and my providers for aesthetics and sexual wellness. And then we'll get into a little bit about pain and inflammation, but I really think we should add that as another webinar because we do so much. Okay, so without further ado, we should get started. Okay. Oh, I know. And you guys always join me and nothing ever works. So let's see. Oh, thank you. Okay. So what is regenerative medicine? It is the process of replacing, renewing, regenerating human cells, tissues, organs, and proteins in order to restore function and homeostasis in the body. Okay. So essentially, a lot of the things that we do in medicine, unfortunately, are degenerative or toxins. Okay. So, in essence, they help things by covering up symptoms or treat symptoms, but they don't really actually regenerate and renew. And that is literally where all medicine is going. That's where body medicine is going. That is where spirit medicine is going. That is where aesthetic medicine is going. So if you follow me, you know that. So we offer PRP, PRF, mesenchymal stem cells, Wharton's jelly, all of these things that are from placental tissue derived. And we'll talk about that a little bit at the end. And then exosomes for aesthetics and for body pain and inflammation. So literally, you can use regenerative medicine from head to toe, whether that be hair regeneration, tear trough, full face PRP, breast lift, buttock lift, injected into the knees, injected into joints, injected anywhere into inflammatory tissues. So it's my favorite thing. Okay. So absolutely everything we do can be treated. And what you'll learn from this talk is that there's really very few contraindications, if any, and very few side effects because it is from self, meaning it is autologous from human instead of outside of the body. Okay. Which means it's derived from other tissues that could affect us and have inflammatory effects, right? Such as steroids, such as some of these other things. Okay. So that is why it is literally where I spend all of my energy and my focus at aNu in the last several years is regenerative medicine. So it is the most exciting thing I've ever done, the most exciting thing I get to bring into the practice, the most exciting thing I get to teach patients about and staff about. And yeah, so my story, and I don't have this slide in here, but I have Lyme and mold and autoimmune and fibromyalgia, and I don't have a spleen. So I have a very compromised immune system. And I decided 8 years ago to get out of traditional medicine and really find and explore other ways to treat inflammation as a whole. And the amazing thing that I found, not only from treating my entire body and my patients' bodies, which are all getting better, is also aesthetics, right? So, as a 43-year-old female, I am exactly the demographic that patients are coming into the practice and looking for something to do differently. And that's something that we offer that a lot of other places don't offer, which is how do you regenerate tissue? How do you regenerate collagen? How do you really, really fight aging and stay in that anti-aging space? So that's what we're going to talk about. Okay. Oh, I know I have to hit the right button. Okay. What is it used for? Everything. We talked about that. It is the future for disease and aging, whether that be body, aesthetics, skin, etc. So Revive by aNu is a sub brand of my business, but just remember everything is aNu. And that's the sub brand that we do regenerative treatments under. The beautiful thing is we can do everything synergistically. So if it's PRP, ozone, exosomes, biologics, whatever that may be, everything that you add to that is going to have more anti-aging properties. Okay. So what can we treat? Exactly what we talked about. We can treat autoimmune, heart disease, respiratory conditions, COPD, chronic infections. Yes, we do use regenerative treatments for COVID, flu, etc. Injuries, chronic pain, joint issues, arthritis, orthopedic conditions, infertility, sexual rejuvenation, O-shot and P-shot. And then, of course, aesthetics, dermatological conditions. I treat a significant amount of those when I was in primary care. I was always the forefront of seeing all of these skin conditions. And I didn't really refer a lot because I was always in underserved areas. So I always had to figure out what they were on my own, how to treat them, how to use the treatments that we had in our office instead of sending them somewhere. And in traditional medicine, a lot of what we have to offer, unfortunately, is steroids. And steroids treat symptoms, which is great, don't get me wrong, but it doesn't find the underlying cause of what's going on. And in dermatology and skin, in functional medicine, anything that's going on in the skin is from the inside, and it's usually from gut. Okay. Then there's cosmetic and aesthetic issues. And that's, I can't say it's my favorite because I use all these things for everything I have, but obviously aesthetically, I love it. Skin, inflammation, scars, wrinkles, pigmentation, collagen, volume loss, hair loss, all of it. How do we deliver these techniques? Injections, we do it topically. And then as you'll see, we also do it intravenous. We do it in joints. We do it muscle, intranasal, nebulized, etc. A lot of these very advanced treatments. So of course, I already told you it's the most exciting thing I do. And that's really because I brought it in because of some of the things I was going through and some of the things my family and patients were going through. And I've seen extreme things happen, not just on the aesthetic side, but when it comes to functional medicine and how this can really improve patients' lives. Okay, PRP. What is it? People started talking about PRP in the last year or two on Instagram and all these things. We've actually been doing PRP since I was across the street, doing medicine with just my former partner and just one other staff member, and that was 7 years ago. So we've been doing PRP for a long time. I've really been interested in PRP and its ability to help heal the body. And it's not that it has really advanced over the last 10 years per se. It's that now we have all of these new tubes that you can use that get more platelets, etc. And I'm a nerd, as you know, so I'm always changing these tubes and stressing my staff out and getting the newest technology. So our platelets inside of our blood contain hundreds of proteins, and they're called growth factors. And they're extremely important for healing of injuries. Okay. So the same thing that comes in and heals injuries in our body is the same thing that comes in and creates collagen. So we use those properties to help a lot of things. So we're basically using our own body to heal itself. And for me, that's profound because you can't really have a reaction to your own self. So when patients don't want to do Botox or fillers, or they want something natural, or they don't want to have surgery, that's where PRP comes in because it's autologous, it's yourself. You cannot have a reaction. I have not seen one yet. You could have swelling and a little bit of inflammation, which is exactly what we're asking for a day or two. But other than that, we don't really see any side effects. So it's a concentration of growth factors that can be 5 to 10 times greater than usual, depending on what tube you use. We're getting ready to get a new tube again. I'm meeting with a couple more providers, and we're always going to find the tube that gives us the best concentration of PRP for the patient. Okay. So it's a concentration of your own platelets, that have reservoirs for growth factors and healing agents. We draw your blood, we spin it down in a specialized centrifuge. It's got to be the right time frame, etc. It's got to spin the right time, etc. So it's not just your typical centrifuge that we use when we're drawing your blood. And so what happens is then we separate your red blood cells on the bottom from your platelets and your PRP. Okay. So then we get your PRP, which is that beautiful gold color that you'll see, on Instagram, etc. We call it liquid gold because it is. And then we basically introduce that back into your tissue. We can do that topically, or we can do that through joints, or injected. Okay. So PRP tells your body to signal your own growth cells to jumpstart healing, repair, rejuvenation, right? So we're using your own inflammatory process that happens no matter what. If you get a virus, if you get a cut on your skin, etc., the same process that happens is it comes in because of inflammation, and therefore within the next 7 to 10 days heals it, but also increases collagen, and increases healing. Okay, so it brings in interleukins, cytokines, all these fancy things that we learned about in medical school. But really, the end result is that we are healing from within through ourselves. And I think that's the most amazing thing that one of the things medicine has found recently. Okay, so again, virtually no risk of disease or allergic reaction. It doesn't require any incisions. It's not invasive. So you don't have to have surgery or any of these other things. You're in and out of the office within an hour. And, patients always ask me, how long does it take to have a procedure? Literally, the procedure is not what takes a long time, whether we inject it or apply it topically. It's actually the draw the blood, spin it down, prep it into our tubes. That's usually a 30-minute process. Photos, numbing, etc. When I go into a room and inject it, or apply it topically, it's very, very minimal. Okay. Again, we collect it, we separate it, and then we extract your PRP. And that's really important because it really depends on the tubes and advanced technology that the company that you're using can provide for you. Okay, so we're going to talk about sexual rejuvenation first, because a lot of people are interested in the P shot and the O shot, and you should be. I'm not afraid to talk about these things. I've been doing sexual rejuvenation for 8 years. In functional medicine and wellness medicine. But prior to that, when I was in traditional medicine, so many women and men, but primarily women, because I did so much women's health, were coming to me and had low libido or vaginal dryness or vaginismus or all of these issues that are very, very hard to treat in traditional medicine. So I got very interested in how can we treat this without medications. Okay. The other thing is incontinence. Unfortunately, incontinence medications cause more dryness. So if you're a female that has incontinence and you're menopausal, perimenopausal, those medications are going to make this worse for you. Okay. So P shot will improve erectile dysfunction. It will help lengthen girth. That is not the main reason to do it. Okay. But yes, it does help for most patients. It also improves arousal and orgasm. Okay. And sensitivity. O shot for women improves lubrication, tightens the tissue, reduces incontinence, and improves arousal and orgasm. So I hear people sometimes say, "Oh, I don't need that." There's very few men or women that I've met in medical practice over the age of 30 that don't need this. And the other thing that the P shot can treat that's not on here is the medical condition called Peyronie's, which is pretty serious, but it can very, very, very much help this condition that's very tragic. Okay, so P shot enhances sensation, arousal, orgasm, helps correct ED, lengthen girth, Peyronie's. We draw the blood, spin it down. We numb the tissue 30 minutes prior, so that tissue is nice and numb. Very comfortable, no downtime. So usually the first thing that I hear from patients when I talk about this is, oh my gosh, right? And I also talk about it out of the office because people ask me a lot, like, what is this thing you're talking about? And obviously, most of us are extremely nervous to get injections in the genitalia. Okay. I will tell you the way that we do it, the way I was trained by Dr. Runnels, who created the O shot and the P shot, who I wrote a book with during COVID. The way we do it when we numb the tissue, and it's just pressure. That's really all you should feel. Most patients should not really feel anything else. Okay. And so I know it sounds incredibly intimidating, but when you have the right provider doing this treatment for you, it should really not hurt. Okay. You might feel pressure for a few minutes, like you have to urinate. That's it. Okay. Just like if you had a catheter or something, catheter is out, those things go away. So we're talking a few minutes. And after that injection is done in a couple minutes, all of that is gone. All right. So over the next several months, 3 to 6 months, whenever we're talking about vascularization, regeneration of tissue, that takes anywhere from 3 to 6 months. Collagen and PRP and all of these things do take some time. And that's okay. It's just that you have to be patient while they happen. Okay. So what happens is over time, the PRP brings in blood flow, increased blood flow. And whenever there's increased blood flow, it's going to bring in oxygen. It's also going to bring in nerve supply. So when a patient takes Viagra or some other sort of ED medication, what that's doing is actually it's a nitrous oxide medication. It is actually increasing blood flow to the area and increasing oxygenation to the area. So PRP is doing that, but it's actually going to give you a sustained result where you don't have to take something every single day, and it can really improve all of these things synergistically and give you a much more prolonged result. Okay. Exactly what we talked about again: visual, blood collection, separation, and then we inject it. Okay. There are 5 injections. Men always ask, but again, we numb the area, we numb the tissue, and it is extremely comfortable. Okay. Nobody believes me, but afterwards they're always like, oh, okay. So here we are: neovascularization, sensitivity, firmness, size, 5 small injections, areas numbed, painless, no downtime. After this procedure is performed, there is no downtime. You can go do whatever it is you want. You can have intercourse, you can go swimming, you can go exercise, you can go do whatever that is afterwards. Same for women. Okay. O-shot. We've been doing the O-shot for longer than the P-shot, and we've had some incredible results with that as well. So same philosophy here. Okay. It is a way of addressing the physical causes of sexual dysfunction and urinary incontinence. So this is something that I think is really important because most women experience these things if they've had childbirth. As you age and as that pelvic floor that holds everything in, once you've had a childbirth, a lot of that tissue separates, it gets weaker, gravity happens. And so then we have problems with rectum, bladder, uterus, vagina. So I think it's really important that we talk about it because these are things that can really help patients. So it helps with urinary incontinence, right? And that way women don't need these medications that further cause vaginal dryness, mouth dryness, eye dryness, etc. Elimination of pain or discomfort during sexual intercourse due to helping reduce vaginal dryness, and increased desire, right? And stronger, more frequent orgasms. The other thing is that it also helps with the tissue inside because we do put that into particular areas, which I'll show you. And that really can help with tightness, firmness, collagenesis. Also helps with a lot of the issues that happen as we age when collagen and estrogen decrease. So as estrogen decreases, lubrication decreases in the vaginal tissue, but unfortunately that also makes the grape, if you will, become a raisin. Okay. So how can we treat that without estrogen, even though estrogen in conjunction is a great thing to do? How can we do that without those things? This is one of the alternatives to that. Okay. So it's a way to transform vitality to help sensation. All right. Sensitivity enhances sex life. There's a lot of patients who have benefited greatly. The other thing that I've seen a lot is, unfortunately, cancer patients, post breast cancer patients who unfortunately can't be on estrogen, estradiol, some of these other things. How can they get their life back? Because I truly believe that relationships and sexuality is a big part of that. So they can actually do the O-shot or Thermiva, which we're not going to talk about today, to really help with some of these symptoms. Okay. Urinary incontinence, to help with leaks, etc. Literally, when we go in the room, should take 5 minutes or less, and you really should not feel anything other than a little bit of pressure. Okay. So it's a great thing. You can use it in conjunction with topicals. You can use things that we have like Foria, which is a CBD coconut oil lubricant. You can also do it in conjunction with topical estrogen, estradiol, I should say. You can use it with vaginal estriol, DHEA, testosterone, or scream cream, which yes, we do formulate and prescribe, but also just in and of itself, this is a huge game changer for a lot of women. Okay. No downtime, like we talked about, and virtually no pain. We inject in 2 sites. One is the clitoris, and the other area is the G spot. And medically speaking, that is the anterior portion of the vaginal wall. So it's the upper portion, and that is where we help with incontinence. Just happens to also be where the G spot lives, so we can help both things at once. Okay. All right. Moving on to aesthetics. So, how can we use PRP and all these regenerative therapies to help the face and neck and body? All right. So, we can use topical PRP with essentially anything that we do. You could, yes, apply it without any procedures, but my recommendation is to always apply it whenever you have a procedure such as Moxie, Halo, Vivace, Morpheus, microneedling, Aquagold, anything that opens those pores in that tissue in the face, right? Why? Because when we create those little micro channels through microneedling or any of these other advanced treatments, we are creating like a sponge in the face, okay? And when we create that sponge, when you apply PRP or exosomes, which we'll talk about later, it is going to absorb right into the skin. There's a lot of things that's going to help. First of all, it's going to reduce your downtime because it's going to reduce inflammation, redness, swelling, etc., because it's going to improve healing. It's also going to improve the results of whatever treatment you just had because it's going to increase collagen, thereby helping improve your texture, your tone, your pores, also just brighter, tighter skin. So if you've heard me talk, and a lot of you have before, I will never, ever, ever, ever open my skin without doing some sort of treatment. And hopefully we'll post some of the videos and pictures that I just recently had of having Moxie again and having Vivace again. I had Vivace 2 weeks ago with my nurse practitioner, Michaela at Leewood, and we injected PRP under my eyes, in my nasolabial folds, in my pre-jowl sulcus, and then we did it all over the face. And we did exosomes all over the face while the skin was open, okay? I like glowing skin. All right, so why would we do it? Everything is synergistic. Can you just do Moxie, Halo, Vivace, Morpheus, microneedling? Absolutely, 100%. I still recommend all of those. But I really am trying to help teach patients and teach staff how you can get these synergistic effects by combining things that will really help increase collagen and improve our outcomes. Okay. So again, PRP, what does it do? Helps with dark circles under the under eye area, fine lines, acne, crow's feet, sun damage, uneven skin tone, texture, crepey skin under the eye, the neck, and décolleté. These are big areas. You know, since COVID and tech neck and everybody zooming and doing all these things, I've treated more of this area probably than I ever had in the 10 years combined prior, and also this area, okay? This is a big area that women don't like. Men also are starting to come in a lot for this procedure, and there's just not a lot to offer under the eyes for the tear trough. And we now have a lot of these advanced things we can do to really help that area, because filler, as great as it is for other areas, it is not the best answer for under the eyes because of swelling. There's just a lot of complications. I've been injecting the tear trough for 12 years. It's still not my favorite thing to do. Now that we have all of these other things, I will always opt for some of these other things. Okay. So I really believe you can see the improvement in the tone of your skin immediately. But remember, all the way up to 3 to 6 months. Okay. And I always recommend, if it's the first time you're doing something to enhance collagen, you're going to do a series of 3 every 4 to 8 weeks. And then what you're going to do is you're going to do your maintenance therapy every 9 to 12 months. So for a lot of my patients, I recommend that they do that every fall or winter so that they can really enhance that glow, the texture, reduce those pores, and really work on a lot of things that have happened over the summer with UVA, UVB damage, and just a year of aging, honestly. All right, inject it. So kind of what I alluded to before, we can inject PRP in the tear trough, nasolabial folds, pre-jowl sulcus, in the temples, in the jawline, in the neck for the necklace lines, in the décolleté. About to tell you about the PRP breast lift that I do, the PRP butt lift, etc. Yes, you can put PRP anywhere. That's what I love about it. Okay. So when we do the tear troughs, we inject the tear troughs alone. But as you can read on here, we can inject all the areas. Okay. Some of my patients, when we do tear troughs and we do a series of 3, what I'll do is on the 3rd round, if I don't feel like you've gotten enough volumization, what I will do is then add filler. Why at that 3rd round and why not on its own? Because this skin is so thin under here that it shows everything. And I don't want filler to be under there looking slightly lumpy or bumpy or migrate or cause more swelling. So as we use PRP, and that helps rejuvenate the collagen, thereby helping this skin to get a little bit thicker, not show those blood vessels, help with that crepiness, those fine lines and wrinkles. If we really are still trying to tackle some of that volume, right, then I will add some filler, but that's, again, not my go-to unless I really have to. Okay. Everything is about how to look natural, how to still look our age, how to just prevent aging from happening. But I also don't just want to prevent aging, right? I'm 43. I'd still like to look 38 if I can. So how do we bring that into the practice and help our patients get that glowing skin and that skin that they really want and still look really natural without all of these synthetic things? Okay. Facelift. So that's where we are adding it all over. Same thing as the last slide. And, people always say, again, how long does this last? All the way up to 2 years. But remember, if you wait 2 years to get filler again, or to get PRP again, or to get Vivace again, whatever that may be, now those results are gone and you've aged 2 years. So I never say wait that long. Yes, reps will say, and yes, brochures will say, oh, it'll last 2 years or 1 year. But remember, we're still aging and we still want to prevent aging. So I never tell patients to go more than a year without some sort of collagen enhancing treatment. Okay. And trust me, I don't wait more than a year. Other options, stretch marks on the body and scars. I do a lot of scars. I do acne scars. I do scars from surgeries, accidents, trauma, keloids, etc. Okay. That's one thing that I definitely do. The other thing that I do personally, and my other staff don't do, is the PRP breast lift. I've actually done quite a few lately. We're one of the only practices in the Midwest that offers this option, and it's a great option for so many women, especially as a provider that has autoimmune myself. What can we do to help maybe prevent women from needing to get breast implants? Okay. Not against them, no issue with them whatsoever, but I know that there are some concerns and some issues with them with autoimmune disease. So what can we do? We can inject PRP. It's much more volume than what we would do in the face. Okay. And so what that can do is help a few things. You can do it in the décolleté to help with those lines from the creases when you lay on your side. You can do it to enhance volume in the breast. You can also do it in patients who have already had breast augmentation but have a separation in the middle of breasts. You can do it for sagging breasts. There's so many things you can do it for. One of the consults, or actually I've had a few consults in the last couple of weeks for women who have breastfed and have some of those stretch marks and just have some of that sagging, but really do not need to have some sort of breast surgery. Those are great candidates to have a procedure like this. Literally, we draw your blood again, we spin it down, just a larger volume. I inject it with a cannula. The only needle is at the insertion point, which is above the breasts up here. There's no downtime. There's a little bit of achiness, and this is something that can really improve women's texture of the skin, stretch marks, enhancement, volume, etc. Same thing as if we were doing it in the face, just at a much larger volume. Okay. Exactly same thing here. Skin imperfections, cleavage, little to no risk, volume, etc. This is such a wonderful treatment for so many women. The big questions I get asked, which is why I always like to go over this when I do the talks, how long does it last? Anywhere from 1 to 2 years. Every single female is different. It depends on how you create collagen. Are you really good at creating collagen? Do you take care of your body? Do you have a lot of toxins? Do you take collagen? Do you take a lot of nutrients such as IVs or vitamins and minerals? Do you eat really well? All of those things matter. It also just matters genetically. Are you good at producing collagen? A 43-year-old could look very different just based on their genetics. And so those things definitely have an influence. PRP butt lift. I do quite a few of these, and I also combine this with Sculptra to get an enhanced result and a natural result when I combine it with Sculptra. Same thing. Okay, you could do it in the hip dips, where we start to get that, if you will, that pancaking on the sides and on the back side. And so the other thing is for stretch marks, reducing scars, cellulite, etc. Because remember, increasing collagen. Anytime we increase collagen, we're going to improve those skin imperfections, create volumization, help improve that skin turgor or tightness, and reduce laxity. There you go. Same thing. 1 to 2 years, depends on the patient. Obviously not in this, not something we're talking about, but we also do cool tone, we do evolve, we do radio frequency tightening. So when you combine those things with this or Z-Wave or Sculptor, etc., you're going to get a synergistic effect, because remember, all of those things are for tightening and collagenesis, also for EMS muscle contraction. So when we're treating something like the buttock, we have a lot of modalities that we can use in conjunction to really give you that result you want. I know, all the toys, it's crazy. All right, other things. Injected PRP with Vivace or Morpheus. So this is where we're talking about radiofrequency microneedling, okay? In conjunction with microneedling or RF microneedling, that's what I always do. Actually, since we bought Vivace and Morpheus, I think I've only done microneedling once. If I'm going to do something and it's not even downtime, it's just the time on the table, 30 minutes for me, I'm going to do something that gives me more results. So what's the difference? Microneedling is still the same, right? You're going to get 1 to 3 millimeters of depth. We're going to have those needles go in and out, which is great, but we're going to move those in a circular motion around the skin, anywhere that's to be treated. The difference is that when we do Vivace or Morpheus, we're actually applying RF. RF technology is heat. So I'm going to 42 degrees centigrade, and I'm actually applying that down into the dermis at a deeper level. Okay. When we do that, we're going to get more collagenesis, more tightening, more neovascularization. What are the words you all care about? Tightness, right? Improve texture, tone. Again, that's what I'm going to do. It takes the same amount of time to do Vivace or Morpheus as it takes to do microneedling. You numb before the procedure for 30 minutes, you do the procedure. And for me, if I'm going to do it, I want the RF technology that goes deeper and gives me that heat stimulation and collagenesis. Quicker healing, actually, believe it or not. I know it's crazy, but we actually have less downtime with Vivace than we do with microneedling. Why would you pick Vivace versus Morpheus? Don't worry, we'll tell you that in a consultation. Morpheus is more for body contouring. Okay, I've had it all over my buttocks and posterior thighs for cellulite and tightening. Also had it in the armpit area to reduce that little fat area. I've had it face, neck, chest, of course. But the big thing is really that ablation of fat. So Morpheus can go a little bit deeper. It can ablate the fat of the jowls, here on the body, etc. So Morpheus is a little bit deeper. It does definitely have more pain. However, it is what plastic surgeons use in their practice. It absolutely positively can give you a different result. Does everybody need that? No. On my face, I use Vivace. Okay, so that's totally dependent upon a consultation that we can help you with. Okay. Hair restoration, one of my favorites. So hair restoration, we've been doing same amount of time, 6-7 years. Okay. But hair restoration has really, really become even more prominent with COVID, because, anytime that some sort of virus or infection attacks your system or your body, it affects the mitochondria, thereby affecting magnesium, B vitamins, vitamin D, etc. One of the biggies that we're finding is lower iron, lower ferritin. So when those things happen, we don't have the nutrients that our body needs in the mitochondria to help us make hair, skin, nails, to help with gut, hair, skin, nails, all of those things, neurotransmitters, hormones. So when our body is fighting an infection, whether it be acute or chronic, and it becomes compromised, our body's not going to spend energy making hormones, neurotransmitters, hair, skin, nails, collagen. Okay. So it's going to go into the other processes to really help us with brain function and body function instead of those other things. So we're really seeing a lot of effects from that with COVID and some of these other infections. Not to mention hormones, menopause for women, andropause for men, testosterone, DHEA, estrogen, all affect hair growth. Okay. So it's so multifactorial how hair growth happens and how hair loss happens. Okay. So it's really common with aging. I just told you all the reasons why. Over 40% of women report hair loss by the age of 40 and 85% of men by the age of 50. That's a lot. And I would say it's probably more than that. That's just who report it. Okay. What makes us different? There's now a lot of places that do PRP hair restoration. I would say we offer one of the best packages in the United States. And that's because I'm always talking with other people and collaborating. So not only do we do PRP ×3 in our first initial treatment, we also add a PEP factor. It's a peptide, and it's actually a copper peptide. And copper actually helps increase hair follicle restoration and growth. We also, after our treatments, do LED light therapy, again, to increase collagenesis and hair follicle growth. I am vitamin B. I am vitamin D the same day. Just told you why, right? With the mitochondria. And then we also include 90 days of Nutrafol, which is one of the best hair regrowth supplements on the market. If I could make something better, I would. I think they still do one of the best things. There's another one, but there's only 2 on the market that I think are the best, and they are one of them. The other thing we include is the aNu MD Home Care Kit. That is the shampoo and conditioner and hair serum that we have created. And it comes in a kit, and you're going to use that in conjunction. Why? It's so important that we treat topically and systemically. Okay. So I want you to be ingesting things. I want you to be absorbing things intramuscular, and I want you to be doing things topically to the actual area. That is where functional medicine plays a difference in how we treat hair restoration versus other practices, because we really do treat it from the inside and the out. Okay. I just told you about all these lovely things. So PRP allows for the hair follicles to become healthier, larger, more hair growth. Again, remember, it's all about neovascularization. We're going to supply more hair growth, more oxygen, more nutrients to that area. We're going to re-stimulate that hair follicle that has kind of gone to sleep, if you will, or lay dormant, and we're going to help that regenerate. Okay, so PEP factor is a fibroblast growth factor, and it's extremely important in how the hair follicle grows and increasing the size of the hair follicle, which we include, which most other practices absolutely do not. What are other things? A lot of people say, could this help my hair loss? Probably so. I always say, let me see the hair to decide, but male pattern hair loss, absolutely. Female pattern hair loss, which you're seeing more and more of in the last couple of years, and I explained why. Hypotrichosis of the eyebrows or beards. Yes, we can inject those areas. Alopecia, sadly, alopecia is an autoimmune condition. So when I see alopecia patients on the functional side or the aesthetic side, I usually make sure that they're seeing us synergistically, not only for the topical side, but also the internal side, because there's a lot of internal reasons to have alopecia. And so we look at gut, and we look at food sensitivities, etc. Okay, it's a really complex disease process, but we're really good at treating it. Other things, talked about it, hormones, iron deficiency, medications. There are medications that induce hair loss. Okay. Little to no downtime. You might have a little bit of tenderness for the first couple hours. Usually that's it. At the time of the treatment, yes, it's a little stinging. I always tell you all, I'll be honest with you. Okay. But as soon as we're done with the treatment, you really only, if you are palpating the area, do you have a little bit of tenderness. Otherwise, it's great. Okay. So patients always say, when will I see results? I'm really, really firm on the fact that not after the first treatment will you see results when you do PRP, Vivace, Morpheus, etc. It takes 3 to 6 months to see these things. That is the way cells regenerate. They have to regenerate from the bottom up. Okay, that's the way collagen works. That's the way hair follicles work, etc. So by the time I see you back for your second treatment, you might not love everything that's happening because you're not going to see it yet. Everything's happening sort of under the surface, or you're starting to see things happen, whether it be skin, hair, etc. By the time I see you back for that third treatment, you absolutely should be seeing things. Okay. Then when we have you follow up 3 to 6 months later for your post, that is really when the magic really happens. We show you before and afters. Okay. So it takes time. This is definitely not a one and done. That's where filler comes into play. That's where some of these others come into play, which is what consultations are all about. It's really the marathon, but trust me, my patient's skin and my skin and everything that I do, they don't look the way that they do by just only doing the one and done. You have to do things that regenerate collagen all the time so that your skin is always regenerating, always producing more collagen, and always repairing. Because from the age of 25 and on, hair follicles, stem cells, collagen, elastin, all of those start to go down. And then menopause and andropause and mitochondrial dysfunction start to happen in our 40s. Okay. So there's never a time in our life where we don't need some sort of regenerative process to help us. Okay. I know I talk a lot about it because I love it. We already talked about some of the things that are included in our package that are definitely not included in anybody else's, because I think it's important. Before and afters, I think it's important to see that this helps. And yes, this is my husband. And yes, he should get this every year. This is part of what he needs. He really needs to have this done every year to help regenerate that hair follicle. Okay. If not, his hair follicle likes to go dormant again. Does he have to have all three again? No, these are the questions we get. You need to do that 3 initially to really get things to start over, whether that be hair, face, etc. Then you want to do it every 9 to 12 months. Okay. All right. Whew. Lots of talking. Stem cells. Okay. Stem cells are what essentially tell other cells to do their function better. Okay. Now, people will ask me, do you do stem cells? What kind of biological products do you use? We used to only use stem cells. Now we also use exosomes. Why? Because stem cells give off exosomes. And so I want to go to the product that stem cells actually give off. So I want to go to the source, if you will. And those are exosomes. Okay. So essentially, exosomes provide the same benefit of stem cells without cells, meaning they are acellular, hard to wrap your brain around. They can be sterile filtered, concentrated, cannot be rejected, can cross the blood-brain barrier, thereby help with my patients who have MS or dementia or Lyme or other things. They have no first pass lung removal, meaning they can help lung things, they can help heart things. They deliver messenger RNA, messenger information RNA, and can travel easily. Okay. So this is a really fancy slide, and what it means is that exosomes are extremely, extremely small. They are nanoscale extracellular vesicles, okay? Meaning that they can pass through tissues very easily to help regenerate them. Really important for me, okay? So they allow cell-to-cell communication. They transport molecules. So essentially what exosomes are, they're just messenger RNA. That's all they are. So a stem cell gives off an exosome. That exosome then goes tells a cell how to repair itself. All right. So they're basically the bus that drops the kids off. They're like, I am the bus driver. I open the door. I let all of these exosomes off, and the exosomes then go tell everybody what to do. Okay. This is how this works. You will see that this is a stem cell. The whole big cell is a stem cell. And then over here in that right upper corner, you're going to see that there is an exosome that exovaginates. Yes, that's what that means. It gives off the exosome to go work on other cells, to fix them, to fix the mitochondria, to fix other things. Okay. So they're given off by every single cell. They're extremely important because they're going to help regenerate things. Okay. So they have an initial effect on helping, but they also have a very prolonged benefit as the signals continue. Okay. It gets super complicated. I know. I don't have to go into all of it, but what it does is the most advanced way we have to regenerate cells and regenerate tissue. Okay, so we use them to support the body's healing processes. Okay, and pause for 1 second because my battery is going to die. So 1 sec, let me hook in my. Da, da, da. I know this is real life. Charger. Okay, I know. All right, so external factors can really hinder stem cells from working versus exosomes are very different in how they work. I use these tissues and biologics to help enhance, right? Everything. My favorite word is synergistic. When you're using PRP, why would you also combine ozone? Why would you also combine exosomes? Because everything that you do is going to enhance your results and cause or allow further tissue regeneration and healing. Okay. All of these growth factors are in exosomes and biologics. So they're anti-inflammatory and immunomodulatory, meaning I use them to help autoimmune disease. Pro-angiogenic, they help with blood vessels. Pro-synthetic, anti-apoptotic, meaning they prevent cell death of cells that we want to have. Anti-fibrotic, they reduce fibrous tissue or scarring in tissues, and they also suppress tumors. Need I say more? Okay. So they support in nature or in utero or in the body. What do exosomes typically do? They support the development of the fetus, cell proliferation, reduce inflammation, prevent rejection of the fetus, promote angiogenesis. Angiogenesis is my favorite thing. So angiogenesis is formation of blood vessels, thereby bringing more oxygen and nutrients to the area. Connective tissue and suppress cancer. All right. Which ones do we use? We obviously use ones that are only approved at a bank. FDA does not approve any of these things, but we only use them from an FDA registered tissue bank. Okay, with the FDA, they're tested for all viruses, all bacteria. Anything that has some sort of property is rejected automatically. Every time we get a tube, it's cryopreserved in a minus 80 degrees centigrade cryo freezer, and it is allotted and extremely regulated. Okay. So we're extremely particular about what we use. There's only 2 companies in the United States that I trust that I would use. And I have really vetted those, been to those companies, seen how they manufacture things, and it's extremely important to me. And, I always tell people I won't do anything for you that I won't do for myself. I was the first one to try all of these, whether it be topically or intravenous or in a joint, etc. And I'm still one of the highest users of these medications or biologics. Okay. All right. Anti-aging slows degenerative processes, prevents metabolic disease, suppresses tumors, helps reduce inflammation, increases collagen. So I use them intravenous to help with inflammation systemically, whether it be a chronic infection or Lyme or chronic fatigue or MS. I also use them in joints to help with osteoarthritis, okay, anything that's inflammatory to a joint process. And then obviously face anesthetics, okay. Dermatologic things, right? We talked about that, scars, anything that we can do to help regenerate collagen and tissue. This is an example of an IV treatment on a rheumatoid arthritis patient who had also psoriatic lesions. So this is psoriatic rheumatoid arthritis, and he has these lesions diffuse on his skin. And remember what I told you earlier, in functional medicine, skin is within. Okay, so skin lesions are always inflammatory, whether that be autoimmune or gut or food sensitivities, etc. So with IV biologics, this is how this patient healed with one treatment. Okay, pretty revolutionary. So we do use this treatment to treat skin pain, chronic disease, anti-aging. We do have patients that just do this for anti-aging, and if everybody could afford that, everybody would. I don't know if you have seen, let's see, Mr. Tom Cruise and his ex-wife, but they definitely are using IV biologics because they are reverse aging. Okay. They don't necessarily talk about it very much, but they are absolutely using these products to help with aging. And I'm sure they have other conditions, but for most of the time, when these people in Hollywood are doing it, it's for anti-aging, and they look great and they feel great. For those of us that don't live that life, it's more about treating pain, chronic disease, inflammation, or at a much more affordable rate, doing it for aesthetics topically, etc. So that's the beautiful thing, is that we can also do it for aesthetics and do it topically and get these huge benefits without having to do it intravenously or in a joint, and get these get all these growth factors and all of these regenerative properties without that huge cost. Okay, we have the whole gamut. IV therapy we talked about, right? All the things I can do now neurologically, autoimmune, etc., that really help. Okay, and I like to look at that bottom again. Is this the fountain of youth? I don't know. Let's ask Tom Cruise and Nicole Kidman. Okay, I have thousands and thousands and thousands of articles. If you'd like to see them, trust me, I can give them to you. Topical exosomes, I don't think we have to go a whole lot into this. We already talked about it, how exosomes work. We do have another topical exosome product. We have a few of them, and what they do is they combine not only exosomes, but growth factors, peptides, coenzymes, minerals, amino acids, vitamins, vitamin C, NAD, all of these things that are anti-inflammatory, help to brighten and tighten the skin. So everything works together. Okay. And I really look for what can work the best, but also be still extremely affordable for a patient. Okay. Rejuvenate the skin, reduce pore size, lesions, scars, redness, irritation, brightness, hydration. I always give this to patients if it's Vivace, Aqua Gold, microneedling, etc. We've talked about this the whole hour. Okay. Here's your statistics. 95% notice a difference. Okay, 91% notice difference, etc. So I really believe in studies. I believe not only in what I see with my eyes and what patients report, but also what do studies say? What do double-blind, placebo-controlled clinical studies say? And I think that's where the medicine is. Okay, that's where evidence-based medicine comes in. I very much believe in that. I want evidence-based to come with everything that we do. And as soon as something better comes out, I will use that, as long as it's still also affordable. Okay. So complexion, brightness, texture, pores. Here's the data. Okay. Reduction in redness and skin irritation, right? So we're still seeing a reduction in the downtime. So they do a lot of split face studies where you can see one side of the face that had treated post therapy with PRP and exosomes, the other side not. And that patient on the side that's treated is going to improve about 2/3 quicker on the side that was treated, meaning less redness, less inflammation, and then improved results. Here are some of the results that you can see, and these are treated versus non-treated with the exosomes to use synergistically. Okay, I think that these results really speak for themselves. More studies. Yeah, that's my son walking down here. Yeah, he shouldn't be down here. Okay, growth factors. I know, I'm a nerd. I have to talk about these things. So TNS, if you don't know me and follow me, TNS is my favorite product. I've been using it for many, many, many years. They reformulated it 2 or 3 years ago. I have used this product now, I don't know, 9 years. I have no idea, 9 or 10 years since it came out. I believe in growth factors. We talked about growth factors the whole time during this talk. That's PRP, that's stem cells, that's exosomes. This growth factor is human derived. I think that's extremely important. There's a lot of plant derived growth factors out there from grapes and leaves and plants. That's great. Don't get me wrong. I think those products are wonderful. But if I'm going to use something, I want it to be human derived growth factor. This is one of them. You get what you pay for. If you use TNS for a week or two, you will never go back to using something else. And you can ask any patient of mine. It truly is a game changer for everything we've already talked about. So remember, 80% of what you do is at home. I do not have time to get treated all the time. I know everybody thinks that those of us that work at aNu, we get treated all the time. We have all these procedures. No, ain't nobody got time for that. Okay. What I really focus on is my daily regimen and what I'm putting into my skin every single day. Best analogy I have, there's the two, right? 80% of what you do is at home. Remember, going to the dentist, you do twice a year. Get your laser twice a year. You get your Vivace, whatever it is, your PRP, okay? You brush your teeth every day. You put on your TNS every day. You put on your HA5 every day. You put on your vitamin C every day. You put on your sunscreen every day. What I love about TNS is it's 7 to 9 products in one. You've got your vitamin C and E on one side because vitamin C has to be protected and it has to be sun protected, which is why it's usually in a brown bottle, or in this case, it's in a chamber. And then the other side is growth factor, and growth factor has to be protected as well. Okay, so it's dual chambered and it has two things that I think are really important, which is growth factor, human derived, and vitamin C and E. Everybody should be on both of those starting at 25, because remember I told you starting at 25 collagen decreases. Vitamin C and E help reduce sun damage you've already had and reduce some damage you're about to get, because we don't live in a bubble. Okay, so visible results within 2 weeks. Just told you that. I believe in clinical studies. I can show you the side-by-sides. Try it. That's what I say. Okay. The other one is my anti-aging growth factor. The difference, why would I do one versus the other? This one does not have the vitamin C and E, so it's about half the price. If you have to start somewhere, it depends on your skin. Okay. It depends on if we're trying to address fine lines and wrinkles and texture and pores. I'd pick this. If it's sun damage, I'd pick vitamin C and E and sunscreen. I don't want to pick, I want both. But when we're talking about cost and we're talking about youth and we're talking about other things, I created this so that there could be something that you could use before you have to go to that higher price point. Okay. Once you use this, though, I promise you, you'll add other things. All right. So it's all about protecting against UVA, UVB damage, correcting old damage, and preventing new damage. And again, I use these two products and I talk about them so much because they're human-derived growth factor. And they're the only two products we contain that have growth factor because I believe in human growth factor. Okay. Okay. So all of our PRP services this month are 10% off if you're a member. Not an extra 20% off. Sorry, that's a typo. They're an extra 10% off, making it 20% off. Okay, for you. We also have promos on all of our lips, lashes, and eye products. And if you have no idea what you need, or after this talk, you want a consultation, please, 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 please call us for a consult. I know this is overwhelming. There is so much that we do. The further I get into aesthetics and medicine and all these wonderful things that we can do now, it gets more and more complicated. That's bad and it's good. It's bad because it's hard for patients to understand and walk in and tell us what they want, but it's good because now we have all of these things to help treat you, but also make you look rejuvenated and still look like you, right? You don't have to have this filler face anymore, you know, this overfilled face where if you go to a lot of practices and all they have are Botox and fillers, that's all they can offer you. There's nothing wrong with Botox and fillers. They are the foundation of medical aesthetics. We use them every day in our practice all day. But how do you get tighter? How do you get brighter skin? How do you reduce pores? How do you work on fine lines and wrinkles? How do you work on texture? How do you work on anti-aging and mitochondrial damage and UVA damage and DNA damage? I know, I nerd out. You do regenerative medicine, right? PRP, stem cells, biologics, ozone, growth factors, anything that you can do to enhance what we already have and what we had in our youth. Okay, we're just trying to mimic what we had in our youth and give it that longevity that we just don't have anymore. We're not giving ourselves something we never had. We're just enhancing what we used to so we can stay youthful. Okay, if you want a consult, call us 816-359-3310. If you already know what you want, call by the end of the month and purchase your PRP series. We didn't talk about, I really wanted to talk about joints and IV and pain and all those things. However, when I did my PowerPoint and realized how long it would be, I'm going to do a part 2. Okay, don't worry. And I'll just do a recording and I'll send it out. So thank you very much. Yes, it's Chiefs Day. If you missed the beginning, in my Chiefs basement. Okay, everybody have a beautiful night. The parade was crazy. It was awesome. It ran right in front of aNu River Market today. I don't know. Maybe if we win the Super Bowl next year, we'll do some big extravaganza. You never know. Never know what's going to happen. Okay. Have a beautiful evening.